Well, first of all, I'm 65 years old, and I've been living with long-term injuries. I reside outside of Victoria, British Columbia, and um, many efforts and many explorations during my whole adult life to uh, deal with some of these injuries that go back to my childhood. They came about in a variety of ways, and eventually led to me not even being able to work full time as a floor layer, which had been my career. I became only capable of part-time work about 10 years ago. 2015, the condition in my neck resulted in me having a new motorcycle accident in the summer of 2015 that concussed me and whiplashed me. I say it in that order because it wasn't till after those relatively new injuries, all those symptoms matched up to the symptoms I had been living with since the concussion whiplash at the age of 19. So they also led me to a neurologist with brain injury credentials who informed me that I would be in difficult time looking to get treatment where I lived. So that now leads me to all of you folks here at Fred Kahn. Dr. Deutsch wrote his book that included a lengthy description on Fred Kahn's laser treatment. It's helped me become aware that the damage to the nerves in my neck were preventing any healing to happen from the previous injuries, as well as major troubles with my digestive tract, irritable bowel syndrome undiagnosed. Prior to coming, I was reduced to not being able to walk the way I had been used to walking, which was a couple hours a day wouldn't be a problem. But that, again, was both made worse from the 2015 motorcycle accident, but had already been there from those previous accidents. Okay, in total about 30, but the last half of those treatments have been the laser points only, and the laser points have been accompanied with the personal laser tool, that the pad style one that I use at home. Without a doubt, it was a long time before I could say that. I would say a good 2 months, but the good thing is the people who were working with me could see me improving sooner than I could. And I knew they were right. It's just that I had been dealing with chronic pain and fatigue and lack of sleep for so long. I know now they are correct, that I was improving within the first few weeks. And I would say it's important to include, I had what I would call a relapse in March, but not to where I was prior to coming here. And it only lasted for a couple of weeks. And how I measure it is my brain functions have improved continuously from the get-go. So during what I'll call the setback, I didn't go near as loss of function as prior to coming. And the other thing I could say is I am regaining my normal brain function skills that are related to working with my hands. Like if I was in better shape physically, I could install floors again because the knowledge of brain functions has come back. And I know that because I'm doing lightweight carpentry repairs and various innovative things like that around the house of the friend that I'm staying with. Hugely significant, confidently climbing a ladder, and that was right off the radar prior to coming here. Everything, I think, virtually known, even including some injections into my neck to help the soft tissue. But if you were to name a popular therapy, I would have covered them from chiropractic, massage, physio, acupuncture, on and on. And what the thing is they would often offer me only temporary relief of the symptoms. It hasn't been until coming here that I think now I'm someone that would likely benefit more from a treatment of that kind, because the lasers appear to have loosened up all the frozen areas that were locked up muscles, locked up ligaments and tendons. I'm in favor of it, I would say 100%, because it shows me the times where it makes an effective immediate result and the times where I'm not as 100% responsive. But it's showing that it's working. Yeah, I'm pleased about that. It's very user-friendly to a guy who can't work a laptop or a computer. And that's sincerely meant, yeah. My bowel system has never worked this good in at least since the 2015 concussion whiplash. My digestive system for the last two and a half months has been close to regular. And when I came here, I was completely away from that. I had no appetite. The signals, the nerves, etc. for appetite and bowel function were simply as if they had gone into amnesia. I'm enjoying something close to regularity. That's huge. I'm all in favor of this having to take another 6 months or more with a comfortable outlook about that, because the severity of my loss of quality of life was way shot. And so after having an injury for 50 years that's getting better, if it doesn't suddenly be magically gone tomorrow, that's not going to alarm me, because it's already improved after living with it for 50 years.